Hi, I'm Dr. Ankita Chodankar. I'm first year PG in MD Pharmacology from Goa Medical College.
Can you tell me why you took a paraclinical subject and why pharmac specifically?
Okay, so all throughout my internship, I realized that I was not really fascinated by any other subject in the clinical side. And then I also worked as an MO for 2 years and realized that this just doesn't suit me that well. And being very interested in academics and research, I thought that pharmacology is a very good field.
Okay.
It is giving me a lot of opportunity. Hi, I'm Dr. Sonam Mamledar. I'm currently in my first year of junior residency. I have worked for like 1.5 years as a medical officer. It was stressful, it was hectic. I used to barely get any time for myself. Whatever time I used to get, I used to just either sleep or cry. So this was not the kind of life I envisioned for myself after 5 to 10 years. So I decided to go ahead with pharmacology. If I want, I can try in corporate sector. I can take part in research. I can take part in trials. I can open my own clinic, or I can become a medical officer once again.
I'm Dr. Vaibhav and currently I'm in third year of my MD in pharmacology. I chose paraclinical because it offers relaxed work environment with manageable workload and there is no night duty.
Hi, I'm Dr. Neha Dani. I'm a third year pharmacology resident. Pharmac had a few remaining seats in very good colleges. And it was my last round for admission, and I had kind of given up on NEET preparation after 2 years of preparing for NEET, one of which was, amidst COVID. So, because of the repeated postponements of the exam, it played a very bad role on my mental health. So, level of physical exertion that comes with the other paraclinical branches, such as with microbiology or pathology, you have to constantly look into the microscope. And if you have any back issues or neck issues, that's going to definitely worsen in those postings, especially considering that they do have night duties, where they have to do this day in and day out. To think that I could do it for 3 years and then for the rest of my life. So Pharmac was a flexible branch for me.
I'm Dr. Amog and second year pharmacology resident. As we all know that clinical branches are very hectic and it is not possible to manage the other aspects of life. And I found that pharmac was a balance between all these things and it was less hectic and good opportunity. So I took pharmac as a
Okay. And if not pharmac, what other subjects you could have gone for?
to be honest, I'm happy with pharmac. Even I had options to upgrade, but I settled with pharmac and it's a good branch.
Okay, point to be noted. He had options to upgrade, but still chose pharmac.
Dr. Aravindh Kumar. I am studying first year pharmacology PG in Goa Medical College. Actually, I completed my UG in 2018. After that, I had worked for nearly 7 years. I had to handle 100 to 150 patients per day. Even single-handed like that. They are not
Too much burden on
too
them.
much burden. Yeah, they are not taking any plans to improve the human resources like that. So being comfortable, I plan to study non-clinical subjects.
The stigma is twofold. There's professional stigma and personal life also you're going to face some stigma. Professionally, your colleagues, your peers, your friends who, you were shoulder to shoulder with till like a few months back, they're going to think less of you because they think you only work 9 to 5.
Yeah.
And you're not seeing patients like day in and day out. They also can consider you lazy now because of that.
Okay.
And personally, a lot of doctors do face it, whether it be a boy or a girl, that they think that, when it comes to matchmaking of profiles, there's a stigma.
Okay, that's a main point. I get that questions a lot.
Yeah, I feel that all these stigmas, they are deeply rooted in these preconceived notions, such as these paraclinical or non-clinical subjects lack a doctor-patient relationship. There is no clinical exposure as such, which is not true. But also there is all of the hierarchy in the hospital system. So yeah, and also I mean interacting with your own relatives, with your own villagers back home. When they ask you, I mean, the first thing that they ask you is, which ward are you in? And you don't know what to say because you do not work in a ward. Also, hanging out with your colleagues who are into clinical does prove a little difficult at times.
They do the people at
Yeah,
home,
they
they
talk
don't
a lot.
exactly know
Yeah.
fields apart from clinical.
You're not practicing that much, so it's very difficult to explain people what you're actually doing. Specifically with pharmac, I find it like it's difficult to explain the difference between a pharmacologist and a pharmacist.
Yeah, true, very
People
true.
often confuse me with being a pharmacist. Then you have to tell them that no, I'm a doctor, not a pharmacist as such. And then it's a mess.
They have to know that you have to do MBBS and then you do MD. So there is definitely a perception that the clinical branches are superior because they involve direct patient care. But paraclinical branches also play an equally vital role in shaping medical practice, whether through research, medical education, regulatory affairs. and the field is evolving and more people are recognizing its true value.
Actually, when I told my senior I took pharma, why you did you took? You did pharmacology, why you in Goa? There are so many controversies like that.
Yes. So you do think there is a stigma around it?
Yeah.
Most people think that clinical branches are mostly associated with only teaching. It's not like that. Okay, there is a lot of scope. You all just need to change your point of.
The common perception is that just because we are non-clinical, other doctors or other students, they consider pharmacology field as not very important. But that is definitely not true. Things are changing. We are getting into research. India is moving forward in that direction. So that does not hold true. And many students are actually choosing pharmacology as the first choice. Actually, everyone just cannot be on the field. Some of us have to be the coaches.
Yeah.
So
Very well said. Okay, can you please introduce yourself?
Hello everyone, I'm Dr. Fernandes. I'm currently in my second year of pharmacology.
Eden, why you went for a paraclinical subject and why pharmac specifically?
During internship, it was any clinical subject was a no-no for me. I figured out that I wouldn't be. I mean, I had a doubt that I wouldn't be able to cope up with it, and then I did my bond for 2 years, and then I was definitely sure that it wasn't for me. So,
Okay.
and pharmac seemed to be the best subject that would give me my work-life balance.
Yeah.
So I could go for either clinical, like establish my own clinic after it, or go into research or academic, anything that I wanted. Also, while studying, it offers me a really good work-life balance.
Okay, and if not pharmac, which other branch you could have gone for?
I have a feeling that I'd be inclined towards pathology.
Okay, pathology. Okay, nice.
Yeah.
Okay, now tell me one pro and con of taking pharmac.
Pro for me personally would be, like I said, it offers absolutely phenomenal work-life balance. I am up from 9 to 5. I'm here doing my academics, and after 5, I go back home. I'm able to spend time doing my hobbies. I'm able to play my board games, be into bachata, Latin socials, all that. So yes, and a con would be, I guess, that it gets a little bit repetitive and stale. If I speak so myself, yeah.
Any piece of advice you want to give to the current batch which is preparing for NEET PG?
If thinking from a pharmacological perspective, it would be that pharmacology is a really good subject. If you want to have a work-life balance where you can have clinical exposure as well as have your extracurricular activities, then pharmacology is the best subject to take. And in general, as you study, don't let peer pressure or your pressure within your home get to you. Just do what you feel best is for you and your mental peace, your physical health.
Very good advice. Thank you so much, Eden.
You're welcome. Bye.
Sonam, if not pharmac, then which other branch you had in mind?
Yes, so it was an internal debate between respiratory medicine and pharmacology.
Okay.
So I spoke with lots of doctors. Then they told me to go ahead with pharmac because it was one of the branch which I wanted, and based on what I envisioned for myself, they were like, "You go ahead with pharmac."
Pro and con you can tell me of taking pharmac.
Cons is there's no patient-doctor interaction as such. There's no clinical interaction. So pros is because it has a lot of scope in corporate sector as well as in clinical sector.
Okay. Lastly, any piece of advice for the generation who's preparing for NEET PG right now?
Yes. So if you are an UG student in your first to fourth year, make sure that you all watch all the long videos of the major subject. If you are in internship and starting your preparations now, focus on the revision videos, PYQs, give as much GTs as you can. But apart from all this, your mental health and your well-being is what is the most important. In this rat race, make sure that you don't lose yourself, because in the end, your well-being and your mental health is going to matter the most.
Okay, Sonam. Thank you. That was a
Thank
very
you
good
so
advice. Tell me one pro and con of taking pharmac.
Okay, so pros will be there's better work-life balance, And career-wise, it opens doors to diverse career paths, including research, and clinical trials, academics, pharma industries. So you are not limited to just hospital-based practice. And cons, there is no direct patient-doctor interaction, which some might miss.
So people who want direct patient, that they miss that, that might be a major con. Advice for the people who are preparing for NEET PG now?
Yeah, advice. Every subject has its own importance, and success depends on your passion for the subject.
Okay.
So find what truly interests you rather than just following trends or peer pressure.
Okay, very good advice. Okay, thank you, Vaibhav. Thank you so much. Tell me about, if not Pharmac, then which other subject you could have considered?
If not Pharmac, to be honest, I would have considered repeating because other than that, I knew that my rank I would not get any good clinical branch in a good college because it's not just about getting the branch that you want. Even your college matters because the 3 years of your life are going to be very.
A pro and con of taking Pharmac.
One pro is that I get to test my technical prowess and improve on it because we do have to incorporate a lot of technology in our work. And another pro is that I get to have the flexibility of teaching,
Okay.
which I really like.
And con?
A con, I'm not sure if I should call it a con or not because I chose a paraclinical branch knowing that it's not going to have direct patient care.
Okay.
So I don't consider that a con at all. But I would definitely say that the academics part is a bit more difficult because we are not exposed to the actual criterions of pharmacology in our MBBS. When we come into residency, there are completely new things that we are not even aware of as doctors, full-fledged doctors.
Oh.
So that's a con.
Any piece of advice for the next generation who is preparing for NEET PG right now?
Yes, focus on your first year, second year subjects as much as possible because they are the formative subjects. You're not going to remember your medicine or your surgery. You can't remember everything. Those subjects are very vast. But if your first year and second year, your foundation subjects are clear, you're definitely going to have an edge.
Okay. Thank you so much, Neha.
Thank you.
All right. And if not pharmacology, which other subjects you could have considered?
I was very interested in non-clinical field only.
Okay.
So I would choose pathology if not pharmacology,
Okay.
or community medicine if I wouldn't get these two.
Okay. Pro and con of taking Pharmac that you face right now.
Pharmac is a purely academic subject. So there is a lot of work-life balance in this particular field. So there is lots of scope for research, no night duties, no emergency duties. So these are definitely the pros. And the cons, I would say just one, that there is no clinical exposure at all. For me, I don't really mind this.
Okay. Now, any piece of advice for the next generation who's preparing for NEET PG?
I would say having preferences for your field is very important, okay, but just don't be stuck with that. You can give a year or two for your preferred field, but after that just take whatever comes in your destiny because life is very long, okay, and it's better to be very skilled in one particular subject rather than started late and never get the kind of skill, never build the kind of skill which is required to be perfect. Not perfect exactly, but very knowledgeable in that particular field. So don't waste time. It's not really worth it.
Yeah, life is very long. What she means is if you take a wrong subject and it feels very long, then you have to suffer for that long time. That's what she means. Okay, thank you so much for insight. If not Pharmac, which other subject you could have gone for?
Honestly, I put only pharmacology in my counseling sessions.
Okay.
Second, I put for community medicine.
Okay, community medicine you could have gone for. One pro and con of taking Pharmac.
Pro means it has a limited duty timing. Means you can from morning 9 to evening 5 p.m.
Okay.
No night duties like that.
Okay.
You can have a break in between that.
Balanced life.
Okay. No night duties.
Yes.
No hectic works.
Yes.
No responsibilities. No much more responsibilities like that.
Yes. Okay. And con? Any con you can
Means
think of?
it's a paraclinical subject. Obviously, some stigma.
Advice for the next generation who's preparing for NEET PG right
Actually, I want to tell the experience is the best teacher.
Okay.
2 days back, I met one colleague of my first year. He was around 4,000 ranks. He told that he was interested in community medicine. He told.
Okay.
But somehow, seeing his guidance and others inclusions, he took MD General Medicine in Goa.
Okay. In Goa.
Yeah. When I speak to him, he felt very stressed.
Okay.
Maybe he will adapt this time.
Yeah.
But what I am telling that is, if you want to take community medicine, take community medicine. Even it was a good rank, higher institution, you can take
Yeah.
like that.
Yeah.
But the experience, before that you should obtain experience,
Yeah.
because experience is the best teacher for all of them.
Yeah.
If you want to take some interesting subjects, you please go on gain some experience.
Okay. You mean to say experience during internship or during
After
a
that,
work?
after that,
After
internship means
internship.
we are working all of the departments. If you want to gain obstetrics and gynecology, you can go some work for maternity hospital for 1 or 2 years.
Okay. You work in that particular department and gain some
Yeah,
experience.
gain some
Okay.
experience. Maybe it will help you to what is the field like this,
Yeah.
what you have to do.
Yeah.
Experience means something different than studies.
Okay.
So I prefer.
Yeah. Okay. That's a very good advice. Okay. Thank you so much, Arvind.
Thank
Okay.
you.
Advice that I'd like to give for all NEET aspirants is that when you're choosing your branch, think about whether you can do this for the rest of your life. And more important than that, 3 years of your youth are going to be gone in this field. If you can sustain, only then take that branch. Don't take it.
Pro and con of taking pharmac.
Pros are many. I feel it keeps you in touch with the clinical aspects also, because you're studying the drugs, you're studying the disease, you're starting from the scratch, and then you can stay with the clinical touch, like treatment part of it also, and then it gives you opportunity to go into other aspects like corporate research, academics. I mean, I am specifically inclined towards research, so I really like Pharmac as a branch.
Yeah. Okay. And any con you can think?
Con, you know it very well. We cannot study Pharmac drugs for long.
Yeah.
It gets saturated.
Toxic.
But yeah, sometimes you can mix it up with other types of pharmacology topics, not just drugs. That keeps you going.
Okay. Piece of advice you want to give this current generation who's preparing for NEET PG?
Okay, pharmacology point of view, okay, I'm pro Pharmac, so I will say it's a great balance to choose if you're looking for something like holistic and different from traditional doctor-patient relationship.
Yeah.
You're looking into research, academic, something different, a corporate lifestyle. So Pharmac is a great branch to do.
Okay. Okay. Very good advice, Amog. Thank you so much.
Thank you.